Welcome to the Hanley Effect, a podcast by the Hanley Foundation designed to educate, change minds, and save lives. Our goal is to inspire you, showcase our innovations, and change the conversation about addiction and mental health. Join us as we unravel stories of resilience, recovery, and hope.
Hi, everybody, and welcome to the Hanley Effect. I'm John Dybin.
I am Dr. Rachel Desico. How you doing today, Dr. D?
I'm pretty great. How are you, Dr. D?
I am good. I have a secret.
Tell me.
We have a guest host.
Wait a minute. Am I being pushed out?
You are. I'm sorry. Do you have a union contract? I'm just curious.
I actually see. That's always get a union contract, but I have to tell you, I actually know who this guest is.
You do?
And if there's anybody that's going to guest host, I mean, you couldn't have picked anyone better.
She's the bomb. So I would just like to tell our listeners that around 6 a.m. this morning, I thought, we need to have this person guest hostess. And I texted her, and she was there. She said she would do it.
Who is this mysterious person?
It is Hanley's own Ali Jimenez.
And the crowd goes wild.
So she is our Vice President of Program Development, most recently developed Casa Flores, our program for perinatal women. And because of who our guest is today, we had to have her join. Ali, you want to tell us who that is?
Absolutely. So it definitely makes sense to introduce the very own Michelle Gonzalez, the Chief Executive Officer at Healthy Mothers, Healthy Babies. She is an extraordinary woman that I've had the pleasure of knowing and working with for about 8 years, I feel like is around the time. She has served on the board of Leadership Palm Beach County. She has served on the board of Bella's Angels. She is a member of the Executive Women of the Palm Beaches, United Way of Palm Beach County's Hunger Relief Committee. Not only is she an incredible executive woman leading Healthy Mothers, Healthy Babies, but she's also a mom with 3 children, a wife, and she spends the majority of her free time on soccer fields, basketball courts, and football fields.
And we always say that all roads lead back to Hanley. Michelle was at one time a member of Hanley staff, Hanley Foundation staff. So Michelle, welcome.
Oh my goodness. Thank you. That was such a fun introduction. Thank you so much. I'm so excited to be a part of this podcast today. I think it's brilliant what you all are doing. And yes, we have history, right? All of us have history together, and most people don't even realize that. So we go way back. So it's kind of nice to see it all come full circle.
Yes, and you are absolutely one of my favorite people on the planet. So let me just say that. Welcome to the Hanley Effect.
Well, thank you. And, I've learned so much about Hanley over the years. Obviously, my time working with you and the foundation and the treatment centers, and just really understanding what you all do as an organization, and just seeing what you're doing now and how that is working in partnership with us at Healthy Mothers, Healthy Babies. It's truly phenomenal. I just love it so much.
Your work there is incredible. Will you just tell our listeners, for those of them who don't know Healthy Mothers, Healthy Babies, the breadth and depth of your work?
Yeah.
Yes, thank you so much for that. So we have actually been a part of the fabric of the nonprofit community in Palm Beach County since 1986. So we are inching our way to 40 years, and our entire mission is focused on access to care, education, and social support for pregnant women in Palm Beach County. And our criteria truly is that you're pregnant and you live here. It's as simple as that. We have 9 different programs across our organization, ranging from prenatal screening and care coordination to group prenatal care, mentoring for teen mothers, a maternal mental health program where we have peer support groups for moms and now dads struggling with pregnancy or postpartum depression, anxiety, OCD. We have an infant pantry for families who are struggling with basic needs. And we have a doula program designed for women of color. So just to kind of give you some statistics, there's about 15,000 babies born every year in Palm Beach County alone. We have some level of touch point with nearly 70% of the women who are delivering them. So just to kind of give you an understanding of the the broad bandwidth that we have here. We have a full-time staff of 67. We have really engaged board of directors and really wonderful funding that we've had for years and years with partnerships with groups like Children's Services Council and United Way of Palm Beach County and the Town of Palm Beach United Way, among others. And you really can't do that collective work without everybody having a piece of it.
That's amazing. That's amazing. So when Ali started to develop our perinatal women's program, you were one of the first names that came to mind for her. Ali, just talk about that. Talk about the collaboration with Michelle.
I mean, the work that Healthy Mothers, Healthy Babies is doing, not just in the community, but even serving the women that we're working with it's been incredible. The ideas that Michelle has shared, that her team has put together when it comes to the different support groups that they offer, the pantry for the moms and the babies. My initial thought coming in to work on this program and wanting Healthy Mothers, Healthy Babies at the table was because of the work that I've seen over the last 8 years or so, and there's really nobody better to do this work and to partner with.
Well, I was so excited when you reached out and shared with us, what you were doing with the Hanley Foundation and developing this, perinatal side of your work. It makes so much sense because, as you all know, there's nearly nothing available to moms in the substance use space. And, we see a lot of those moms, and then we don't really have a lot of options of where to send them. So the fact that this is a collaborative effort of referrals back and forth, and what you're not able to do for those moms, hopefully we can, and what we can't, you can. And so that sort of two-way street partnership is really, I think it's beneficial for all of us.
Yeah.
Yeah, and I think one of the biggest things that's come out of this is that your staff trained doulas. So every mom in our program would have a doula, which is kind of unheard of, that they're getting this experience where they actually have their own built-in support person.
So what's a doula?
Time.
What's a doula for our listeners? What's a doula?
This is the most exciting thing. So about 3 years ago, we developed a doula support program designed specifically for women who identify as Black American. We all know there are racial disparities, specifically for Black women in their birth outcomes, their childbirth experiences, their postpartum experiences. And so we really wanted to design something here that would reduce maternal morbidity and mortality, specifically in women of color. And so doulas just kept coming up as a common theme everywhere we researched, every agency we spoke to. And so we did some digging, what does a doula program really look like? And so doulas are essentially a physical and emotional support partner. It's someone who's there in the prenatal period, during the childbirth, and in the postpartum period. There are doula programs across the country, the majority of which will train women to become typically birthing or postpartum doulas. And so we sort of took a standard model and decided to expand on that. So our doula program invites women initially who identified as Black American, and we want them trained in birthing and postpartum doula support. So we provide that initial training, and then we provide on top of that a long list of maternal health focused trainings that we require our own team to be trained in. So things like trauma-informed care, perinatal mood and anxiety disorders, racial disparities in birth outcomes, all the different things. And, typically a doula would also require, in order to be certified, they have to participate in a certain number of births in order to get their full certification. But traditionally, they would have to find those moms on their own. Our program design includes a matching component. So we already have access to thousands of moms every year. We see thousands of moms face to face every year. So we invite clients of ours who also identify as Black American And we match our doulas with those clients as part of that training. And so mom is getting doula support at no cost. Doula is getting training at no cost. And we are then fully certifying women to really have a comprehensive training platform so that by the time it's done, we're building a workforce of doulas in Palm Beach County. And so initially it was designed as the cultural match of Black woman to Black woman. And we are now expanding that into additional cultures because there is something to be said and research behind the cultural connection of doula to client or doula to patient, and the understanding between the two of them of their experiences, their traditions. And so the goal is that once we're done, with that certification, that doula has then developed a business and developed a business plan, has determined kind of what does that look like for her. And then we are now a referral point for those doulas. So we have the certification and training. And then when all is said and done, our certified doulas are on our website. So any mom who wants a doula can go online and say, these are the ones I really truly can trust. They've had an intensive amount of training. They've worked with women already. And they're all, they're independent contractors. People can hire them. They know how to handle their own billing. We're not affiliated with that at all. We're just there to be a referral point. And so in the development of that is sort of when Ali had reached out and said, this is what we're doing at Hanley. And we'd like to get doulas involved in this program. And so my understanding is that some of our certified doulas are now working over at Hanley with your moms. And so that again, full circle, it's just the most exciting thing happening, I think, for both of us.
Ali, tell us what that looks like on the Casa Flores program. Give us an anecdote. Make us cry.
Oh man, there's lots of tearjerker moments. I think one of the biggest things is that we've seen the doulas that have been trained by Healthy Mothers, Healthy Babies, and they have just come in and been able to build relationships with women that have really difficult times trusting people. And so they are the person that they now know they can reach out to. They can lean on them for support emotionally when it comes to how to burp a baby properly. My baby's not sleeping at night. What do I do? They're in treatment without a partner. They're in treatment without a family member. They're literally there, and we have essentially become their family. This doula is really their person. And so I think for, women that are mothers or even fathers, think about when you were home at night after you had a baby and you're alone, and how important that sleep is and how important that respite is. And these doulas are providing that support to these women who are in such a critical time where the rest is so important to their recovery and their treatment. The stories that I've heard from patients of their connections to the doulas and how they don't think they would have been able to get through childbirth without them. I mean, it's amazing. Like taking them Chick-fil-A at 11 p.m. because the doula's been at the hospital for hours and hours, and it's like, I don't want to leave because I want to be there with this patient. It's amazing. It's amazing.
Yeah.
And the other piece of this too is, what we really want to see is what is the birth outcome of that baby as a result of that added support? And then what is the postpartum experience looking like for those moms with that added support? And so what we've seen already in just, having this program for a short period of time is, about 85% of the babies are born healthy so far. And, we're talking more than 5.5 pounds, greater than 37 weeks gestation. That's what we want to see. And then we want to see that moms who maybe had some challenges in the prenatal period have now addressed and overcome those challenges in the postpartum period. But then on top of that, you have some of those moms that are in the postpartum period and they don't know how to manage their emotions, or they're not quite sure, is this baby blues or is it something more serious than that? And so now these women have this network of support between what you're doing at Hanley, what the doula has been trained to do on their behalf, what we're doing in the maternal mental health space. So you kind of, I think it's a lot to be said that there is this collaborative effort among multiple entities in support of mom succeeding in every possible way.
So I sat with you, actually the two of you, a couple of months ago, and there was something that you talked about that just really resonated with me. And Michelle, I'm going to ask you to talk about it. You're talking about support. So you talked about support with the doulas, support with treatments, support with healthy mothers, healthy babies. Well, that day you talked about support among women, woman to woman, and you specifically talked about those group prenatal visits. And when you started to talk about it, I want to say, I thought, oh God, I can't even imagine that, going to my prenatal checkup with a group of women. And then you started to describe it, and I thought, oh shoot, I missed out, with my two kids, I missed out. Talk about that. And, this is, for our listeners, this is one of those really groundbreaking things that Healthy Mothers, Healthy Babies does and has done that really sets your work apart.
Yeah, and I appreciate you remembering that. And I say all the time, I wish I worked here when I was having babies. It was like I was a little too late to the game because I've learned so much just being in this space. But centering pregnancy is a very unique, evidence-based model of group prenatal care. So kind of imagine, for those of you who've had this experience or know someone who has, you traditionally have about 10 prenatal visits over the course of your pregnancy. You make 10 appointments, you go to the doctor, you wait in the waiting room, you might get 10 minutes with your provider. Ask the questions, do the labs, and then off you go. And then you sign up for some childbirth classes here and a breastfeeding class there and a hospital tour over there. Centering brings it all to you in one prenatal visit along the entire course of your pregnancy. So your prenatal visit within centering is 2 hours. Every visit for 10 visits, you get 2 hours. Your medical provider is in group space with you. There's 8 to 12 women within your group. All babies do within the same month. That's how we group them together. It's by gestational age. And then our health facilitator is there to follow sort of a loose curriculum of all the things that these moms want to know, don't quite understand, are feeling, and we're talking about it. They're talking about it as a group.
Wow.
We teach them how to monitor their blood pressure, their weight gain, their just like sort of the basic health pieces of their pregnancy. But then they're doing a simple belly check, which is traditionally what you would do in your provider's office. It's, they're measuring the growth of the baby. You might ask a few personal questions that are a little private, but essentially your conversation is in group space. Now, if you needed something more invasive, you would make an additional appointment with your provider. But what's happening is, while mom number 7 is doing her belly check with the provider, all the other moms are having some water, they're grabbing some yogurt, some bananas, and they're chit-chatting with one another, and they're building these relationships with one another. Then they're sitting in group space and they're talking about, I'm feeling this kind of funny thing in my chest. I don't know what it is. Well, that's heartburn. Let's talk through that. Are the rest of you feeling that way? Or my partner doesn't seem very supportive. How do I handle that? And so we're there, the health facilitator and the provider, to really support those questions, answer the questions, get the group feedback. But really what the end result is, and this is based on research, is that centering has an impact on birth outcomes. And so what we're seeing is decreased rates of premature birth, decreased rates of low birth weight deliveries. And that's what we want to see. And so the education mixed with the medical component, mixed with the social support, is having a profound impact on the outcomes of these women and their babies. We invite their support partners. So dads are always welcome, But there is something to be said for this kind of group of women who now have become friends by the time the baby's born. And so by session 10, that's the birth session where they bring the babies in. They're all telling their birth stories, and we're taking pictures, and they're having cake, and it's a whole thing. And so centering, it exists across the country. There's only about 6 sites in the state of Florida. We are one of only 2 accredited sites in the state of Florida. And we're hoping soon that we'll be expanding into an additional location in the coming months. So we're happy about that. But the model itself is just, I wish everybody would do it because it's truly phenomenal.
So we are going under construction in our resource center, so maybe we can provide that space for you all.
That
Do
would
your
be so
centering
great.
with us.
Yes, and
Our
we
moms could add in.
Yeah.
Yeah, kind of itching to get into, specific centering groups for moms who are struggling, that are considered a little more high risk, but not high risk. Maybe they have gestational diabetes. That's considered a high risk, but it's not a severe necessarily high risk. Moms who are struggling with substance use, there are centering groups that exist specifically for those moms. And so imagine someone feels so isolated in the space that you're in, within Hanley. I imagine several of your patients, they're feeling so isolated. And so piecing them all together and putting them in a group where they're feeling kind of the same way, physically, mentally, emotionally, imagine what that could do for their outcomes.
I mean, as the token male in the room, but a father of 4 who's been to 40, 50, or 60 of those 2-minute visits. That is blowing me away. The whole concept, and I was wondering, did the dads or the partners, are they there or are they not? But the very idea of that cohort of women, and I'm thinking, man, what would it have been like if there was also that same thing, and we had a cohort of new dads too, maybe who
good.
supported, and could ask questions like the questions that, because I love the cohort together, but I think you're right. The moms are going to have very specific things to share, and that would have been game changing for me as a first time. It's been a long time since I've been a new dad, almost 30 years, but I can tell, it would have been game changing, and we're not even having to deal with all the physical stuff. So I didn't mean to butt in, but that's flipping brilliant. That is so exciting to me.
And I'm so glad you did, because we are trying to do a better job engaging dads. We've always attempted to engage dads, and there are lots of dads who participate in our centering groups. But we also have a program called Circle of Moms. And so Circle of Moms is dedicated to, it's a peer support program for women struggling with pregnancy or postpartum depression, anxiety, OCD. How am I feeling? What am I feeling? How do I cope with that? And so again, similar to what centering is, it's groups of peer support in the mental health space. But we attempted to, or we're still doing, we now have Circle of Dads as well. And so similar concept, but getting the dads more engaged in these conversations. We're not really seeing the participation we would like to from the dads independently, but then we also started couple circles and understanding, things do change in your relationship when you have the first baby compared to the third baby. Things change. You're managing your relationship just being different. And so we are seeing much more interest in the couples groups because there is a lot to be said for that enhanced communication during a time that could be really challenging for moms and for dads.
That is so fantastic. I mean, all of us, we live in a system, and sometimes we treat like as if each of us are separate from our system, but we're not. Mm-hmm. And you're hitting it all. You're not just doing the feeding, making sure baby has food and things. Those are real important, but you're really truly doing systemic work to heal the whole system and to make it a healthier place to be.
Yeah. And really, I mean, sort of bringing it back again, partnerships like this between Healthy Mothers, Healthy Babies and the Hanley Foundation. I mean, the fact that the doulas that you're working with are fully trained by us, they also know everything we do here. So when they're working with your moms and there's a need that you all don't meet because your focus is substance use and getting them through that treatment, they can turn around and come back to us, and we can work with your team to make sure that that mom has what she needs. And so really it's that client-centered idea of just making sure that mom in every aspect possible feels well supported throughout her pregnancy and her postpartum period.
Michelle, I'm curious how often, and I know you send patients our way, but how often, historically, have you run across a mom who also has the disease of addiction?
So I don't have specific data right off the top of my head, but I will say our moms who are struggling with substance use are typically too embarrassed to say so. And I'll tell you a story, and I'll never forget this. And it was a few years ago, several years ago. We had a mom who met with one of our care coordinators. They did, a 2-hour intake. We dig deep. I mean, we are going deep into what this client might need as far as not just the access to care, but social service as a whole and healthcare navigation as a whole. And our team develops really trusting relationships with our clients. I mean, they're excellent at it. And mom left, and a few minutes later, someone went to use the copy machine, and the mom put a note. She must have walked past it and put a note in the copy machine that said, "I'm using drugs." And so it was, even after all that time with her, she wasn't ready to say it out loud, but she was ready to tell us. And so I think there is something to be said for the relationship building that I know our team is successfully able to do at the very start of our connection with a mom. And it's really what you all have to do with your patients at Hanley. I mean, if you can't develop that trusting environment, they're never going to tell you. And they may not tell you up front, but they're eventually going to tell you. And so some of our moms are right off the bat, they will say, "I've been using marijuana, I'm trying not to," or "I've been drinking, I don't know how to stop." They will be very upfront about that. And then there are others that it may take a couple of conversations to understand what they're really going through.
Yeah. Just a great example of, that truly that courage for a mom to find any way that she could to talk about something that truly is a brain disease. There is no judgment here. This is something that there is no mom who says, "Oh, no, I don't want help for my substance use disorder."
And yet the stigma it's double stigma. And that just feeds into that fear. So those relationships you're developing are beautiful. We're coming to the end of our time. I don't want to come to the end of our time.
I will say, I got it. Sorry.
You go ahead.
I'm butting in. That copier story is going to resonate with me. I will tell you, I just felt the weight of that when you told that story. I mean,
and I think back to, I just wonder, how good did she feel to finally just put it out there?
Yeah.
Right? To just get it. She clearly wanted to. And on her timeline, she did. And so, I think back to like, how good did it make her feel to just finally say the words, write the words?
Right.
And then of course, we did our due diligence in making sure she had what she needed and the support that she deserved. And so I imagine that's the case for all of your patients, that it's hard to say the words. And if you have the right people supporting you, then maybe it makes it a little bit easier.
Yeah, I think that's such a great point, is that a lot of times with the women that we're working with, we think that they're going to be vulnerable and we think that they're just going to open up, and that's not true, because they're very afraid of judgment. And so that relational piece is really the key to unlocking and opening, building a relationship. And it validates again, what are the behaviors telling us, right? They might not be saying what they're feeling, but what are their behaviors telling us? What are they modeling? What are they demonstrating? And that's what you really have to look for in working with this population.
So we always like for our guest to have the last word. And so, Michelle, I want you to, if you would, if you're thinking about, and there's all sorts of people that watch this and listen to this. And so I think that I would just like to open it up to you, thinking about what you would want mothers who might be struggling, what would you want them to hear? And then is there something that you would just want our society and people to hear about what you're doing, about your mission, and about women having babies?
So thank you for that opportunity, by the way. I think what I want mothers to know is that there is support and there are resources everywhere. I think sometimes moms struggle with, number one, asking for help, any kind of help, because we all think we can just do everything and throw on our cape and we'll be just fine. And the reality is sometimes we're not just fine. And sometimes we just need those added pieces, but we're either too afraid to ask or we just don't know what's available to us. And so one of the core messages we like to share is that Healthy Mothers, Healthy Babies is available to any pregnant or postpartum woman who lives in Palm Beach County. We have something for you. It may not be all the things, but there is something we can provide to you. And then it sort of coupled with that is I really I wish the community understood better that our organizations collectively work in tandem with one another. We are not siloed. We genuinely cannot function without the support and the collaborations of agencies across this community. And, foundations like yours and, just all the different programs. I mean, we serve a very specific population, but our moms have small children. And we're not serving the small children, but we know who is. And we can connect that mom with the right people who do exactly what we're going to do in ways of support and education and access that supports that entire family. And so I think I wish the community understood better. We don't work alone. We only can make it work with each other.
So good.
So true.
Beautiful. And then what a beautiful just message for our time right now. We can't do it alone.
That's right. Well, guest host, would you like to say anything before we close?
Just thank you for all the work that Healthy Mothers, Healthy Babies has done to support our moms so far. I mean, Michelle has been incredible. There's been a few times where I've texted her at 7 a.m. and said, hey, someone just gave birth. Can I please come by and pick up some things? And every single time she's like, yep, I'm on it. They know you're on your way. And so their team, I mean, everybody there has been so helpful. So thank you.
Thank you, Michelle.
Thank you all so much for your partnership. And this was so much fun. Thank you for inviting me.
Super fun. You didn't have to wear the
I'm kind of jealous.
really good on this end.
We're the cool kids.
Yeah, I think so.
And this is you guys all know each other. This is my first time getting some time with you, and it is my honor. This was just even being a guy sitting over here. I really appreciate all that you're doing for our community and just for being here. Thank you.
Thank you. And likewise, you guys you're changing the game for women just struggling with substance use. So thank you for that.
And thanks everybody for listening or watching. And we'll see you next time on the Hanley Effect.
Bye, everyone.
Bye-bye.
Thank you for joining us for the Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.